Health sciences at University of Southampton is a unique, actually, integrated, interdisciplinary faculty, which we are delighted to have found that in the Research Excellence Framework published in December, we have been evaluated and found to be top for the quality, impact and the research environment that we have here. About every 5 years or so, the government undertakes an exercise to look at the quality of research conducted in every university across the UK. Quite a lot of government money goes into supporting that research, so it's good for the government to understand the quality of research that's being done and get a real sense of the standing of that research and benchmark it across universities and the world. We were absolutely delighted when the results came out to discover that, and the results are sort of presented in different ways, but in the analyses we were top in a number of dimensions. So when you look at the quality of research, we were rated as top in the panel that we submitted our work into, which covered dentistry, pharmacy, biomedical research, nursing and allied health professionals research. So that was absolutely fantastic. We were also found to be performing top out of any of the other universities that put in relation to the impact of our research. So that's the impact it has on society, on healthcare and commercial impact. So for example, we've undertaken work into new techniques for supporting the rehabilitation of people who've had stroke, where colleagues here at the University of Southampton have developed and demonstrated the effectiveness of particular devices for people who've had a stroke, which had never been done before. And developed something called functional electrical stimulation, which are devices that can be implanted under the skin in a limb, an arm or a leg, and they help the process of stimulating movement in individuals who are trying to rehabilitate after a stroke. And there's been something like 16,000 sales of functional electrical stimulation devices around the world, benefiting 85,000 patients following a stroke. And we train something like 2,500 health professionals across 14 countries in Europe to know how to use them. So, you know, that's an enormous web of impact, isn't it, that you can see demonstrated through that work.